Elizabeth Markle from Open Source Wellness. Take it away.
Thank you so much, Rachel. Really grateful to be here. And hi, everybody out there. I'm Dr. Elizabeth Markle. I'm a psychologist and professor of community mental health, and I'm thrilled to be here presenting on open source wellness. So before I get into the nuts and bolts of what we do, I want to orient you to the 4 major outcomes that we're committed to achieving with all of our partner organizations that are listed here. And the other thing you should know that's not on this list, but that's symbolized by our logo, is that open source wellness is fundamentally not a digital solution. We are a human connection solution, or as we like to say, community as medicine, that happens to be enabled by some very basic technology. So here's where we come from. I worked in federally qualified health centers where I watched providers verbally deliver what we now call behavioral prescriptions. They would say things like, you should exercise more, you need to eat better, reduce your stress, and get some social support. And then unfortunately, they would say something that sounds like, good luck with that, I'll see you in 6 months, take care now. Now, to be really clear, this is not the provider's fault. This is the best they have available to them right now. But it's a tremendous equity problem because our patients who have money and privilege might start shopping at Whole Foods or hire a health coach. And for our patients who don't have those privileges, this is a prescription to nowhere. And it's a way that despite our very good intentions, we perpetuate staggering health disparities. So all of that said, in 2016, Dr. Ben Emmer Aronson and I co-founded Open Source Wellness. We are an Oakland, California-based 501c3 nonprofit with a mission of transforming healthcare and health outcomes in partnership with the communities that need it most. And we do this by functioning as a behavioral pharmacy or a delivery system for one universal prescription, which we abbreviate Move, Nourish, Connect, and Be. So here's what it looks like on the inside. Patients are prescribed participation in open source wellness, and the initial dose is 16 weekly virtual groups. These groups are experiential, meaning we don't tell anybody what they should do. We do it together in community and we make it fun. The groups are transdiagnostic, meaning we don't have the depression group and the diabetes group. We have groups for humans who by their nature have strengths and challenges with their well-being. And the whole thing is facilitated by health coaches who are culturally and linguistically relevant. We're currently providing services in English and Spanish and more languages coming, and are trauma informed. So since 2016, we've been delivering these services in California. We recently expanded to Washington and Vermont. And if you look at some of these logos of our partners, you'll notice that they're very different kinds of organizations. So open source wellness can be implemented in clinical, community, low-income housing, corporate, even peer-run contexts. And the cool thing is that almost no matter what context you implement it in, you get similar outcomes. So here's a sample of about 755 FQHC patients. We're seeing significant increases in daily servings of fruit and vegetables, similar weekly minutes of exercise increase. For those participants who join us with an elevated PHQ-9 score, we're seeing about a 50% reduction in symptoms of depression. For our hypertensive patients, we're seeing substantial drops in systolic blood pressure. And then here's the data that really captures the attention of our payer partners and those who are already at risk for outcomes and expenditures. We're seeing about a 77% drop in emergency department visits after participation in open source wellness. So for potential partners who are already in these value-based care arrangements or who have the programmatic funding allocated to achieve outcomes like these, let's talk. But some of our very favorite partner organizations are FQHCs, who tend to have tremendous mission alignment with us, but are still in fee-for-service agreements. So I want to share briefly about how this works with clinical partnerships. The key here is virtual group medical visits. So when we partner with a clinic, the first thing we do is train all of the providers in the clinic to prescribe into OSW. And we teach them to say to appropriate patients, something like, I'm going to write you a prescription, but it's not for medication, it's for participation in a community. When our team of health coaches receives that prescription, we get to work on building a relationship with those patients. We handle all the onboarding, we train them how to use Zoom if they need that, or we support them in calling in via a landline if that's most accessible. But all this engagement is handled by our team, so the clinic doesn't have to do it. The patient then joins their weekly 2-hour experiential group where they move, nourish, connect, and be every single week. And during that 2-hour period of time, one primary care provider who's an employee of the clinic pulls patients aside using breakout room technology for short individual medical visits. When the time is over, they then chart and bill for each of those visits. In between weekly visits, our coaches are providing a ton of phone and text support and gathering the outcomes data that we will then analyze and feed back to the clinic. Now, I want to quote the one and only Jeff Helton, who said to us, "If I'm the CFO of an FQHC, you need to show me how you're going to improve my bottom line today, not maybe somehow tomorrow." So here's how this works out for some of our FQHC partners. Open source wellness groups are large. They have up to 24 participants and 4 coaches per weekly group. And on average, the provider can see and bill for 15.2 patients per weekly group. Now, if that provider were doing individual visits instead for the same amount of time, they'd be averaging about 7.5 visits. So that's an extra 7.7 patients per week per group, which, depending on your PPS rate, translates to about $96,000 of extra revenue per year. Even if you take out the cost of an annual clinical contract with OSW, which is about $81,000, you're still clearing about $15,000 of additional revenue, and that's just for one group. So some of our clinic partners do an English group and a Spanish group, a daytime group and an evening group, and really make this work for them. So we're all familiar with this classic care pyramid with primary care as the foundation. And part of what we're seeing nationally is that PCPs and their support staff are already overburdened. They are expensive and we can't hire enough of them. One of the things that partnership with Open Source Wellness does is that it essentially bolsters the whole clinical care pyramid with this robust foundation of support underneath it, comprised of care coordination, coaching, and community. So when I look at this as a model of care, I can't help thinking about the Colorado Behavioral Health Blueprint for Reform. Open Source Wellness is poised and ready to advance a number of these specific priorities named in this report. And some of them are listed here, but in this final moment, I want to highlight the last one, workforce maximization, and take a moment to introduce the real team behind Open Source Wellness, our health coaches and our peer leaders. So our newest adventure at Open Source Wellness is piloting a health coach training program that will create an employment pipeline so that our patients can become our peer leaders, who can become nationally board certified health coaches that are qualified to work with us or anywhere else. So I'm reminded of the words of Shoma Stout, who a couple years ago said, "Our work is to liberate the trapped and untapped resources lying dormant in our communities." My job at Open Source Wellness is to create structures that channel and uplift the creativity and the wisdom and, frankly, the love of these incredible humans. So our lived experience doing this for 5 years now is that community is the medicine. It's not a side effect, it's the active ingredient that animates really basic wisdom like move, nourish, connect, and be into something that's truly transformational for patients and providers and clinics and communities. Thank you so much for your time, and I welcome your questions.
Thank you, Liz. Well done. Woohoo! I'm seeing a lot of really great feedback in the chat. If you have questions for Liz, go ahead and get them in. The first question that I saw is, how do virtual sessions compare with in-person meetings? What doors are opened?
Yeah, great question. So before 2020, we were a diehard in-person organization. We said, you got to bring people together in person, and we would eat and dance and connect, and it was great. And then 2020 happened, and we rapidly learned how to do it virtually. And we are just now starting to do both again. So we're happy to explore pilots that have both qualities. But what I would say is that doing the virtual work evaporated some barriers. It created some new barriers around access, but particularly for our rural patients, those who have physical and or psychosocial barriers to coming to a place, even to the clinic, this has made it accessible and scalable in a way that it never was before.
Great, thank you. And last question, Matthew asked, this sounds great, but what are the programs that the coaches teach?
Great. So our coaches are trained in a platform that's based in motivational interviewing and cultural competency or humility and being trauma informed and group coaching. So the first hour of the program is large group. Everybody's together, 24 people doing movement and mindfulness and talking about nutrition. And then that large group breaks out into small groups so that a ratio of 1 coach to 6 participants has about 45 minutes together to really go deep and connect. The curriculum that we use is our own. And every week, what's called a spark is presented. It's not really a lesson. It's like an interactive learning activity that incorporates all 4 of our sort of pillars. So physical activity, healthy food, stress reduction, and social connection.
Great, thank you. There is one more question from Aliris from Mental Health Center of Denver, Liz, but I'm going to go ahead and bring up our next panelist, so you're welcome to answer that in the chat. Oh, there are a few more questions, so we'll make sure you get those so you can answer them. In the meantime, thank you. Well done.
Thank you all.